and you will achieve maximum results. Why? The single most important effort you can use to help a victim of cardiac arrest is what? Effective chest compression. So I have to, but we still repeat it because we have not done this one. Apply parts as shown in the picture. So you do this one. Where are we going to put this one? Based on this. But use your hand, don't point finger. Exactly. So apply pads as shown in the pictures. Apply pads as shown. Press pads firmly on skin. Did you understand? Yeah. Do not touch the patient. Do not touch patients. He's analyzing the heart rhythm. Do not touch the patient. Do not touch. So you stay in the shock advised. Do not touch the patient. Don't. You can see that do not touch because if you touch, it's an electric. Press the flashing shock. Press it. You are afraid? Shock delivered. Begin CPR. Oh. Say. Stay alive. Oh. So, see, you know what you have done? What you have done is you have reactivated the heart to begin to pump again. The heart has stopped pumping from cardiac arrest. This
particular training has really impacted us, has added to what we knew before. And then towards this Ember month that we are preparing for the end of the year Ember month, I think my men are better placed now to know what to do. Effective CPR. You know, like the lecturer said, he said, we've left the idea of ABC, of helping victims on the road. We're not talking about effective chest compression when the victim is unconscious. And with this lecture now, we are properly footed and ready for the end of the year operations. We've had a lot of challenges at this Ugu Onyama. It's like a recurring decimal. And then so now that the government is actually coming out with a lot of ambulances to help for rescue, I also want to plead with His Excellency that fine, he has given us the front burner in this lecture, in this teaching. He should also give us the front burner by equipping us with a lot of ambulances, not just giving it to the state, because we are the ones that will actually use it effectively and efficiently. And I can assure him that he will be happy at the end of it. So it's not just getting the ambulances and just leaving them there. He should think of equipping FRSC with these ambulances, commands like 9th Mile, commands like Obolafo, those ones are the critical areas, should be considered in the distribution of the ambulances when he brings it.
Getting the ambulances on the way, providing the centers, providing the call centers. And we can't do that improving that and not having partners in this business, getting them aware and getting them equipped with skills that are necessary. And that's why he is glad to ensure that the training on tips on how to rescue victims of emergencies, accidents and emergencies on the highway is delivered to these people. And it was a very detailed training where all the team members were on ground to show that CPR, cardiopulmonary resuscitation, how to lift an unconscious patient, controlling bleeding, among other things, were detailed to them. But one thing that I can assure you is that alongside with the Ministry of Health, alongside with the instruction from His Excellency, not just improving the infrastructure, we are also retraining on attitude, the way they appear at work, the way they treat patients, the way they talk to patients. We're also retraining our staffs and the health system across the state. What I can assure the public is that when you look back in the next 4-8 years, the health system, the health personnel across the state would have moved far away from what it was to what the global trend is like.
It's a synergy between the state government of Enugu State and the Fire Road Safety Corps Nigeria. Of course, what that has done is to strengthen or to boost the knowledge of the FRC personnel in terms of rescue mission. Of course, for me, I would call it a retraining exercise because the FRC operatives over time undergo training and retraining. But this particular training, I must say, is a very unique one, being that Dr. Yomi Jaye came in person to handle this training program. For the FRC Enugu Sector Command, this Ember month, we have put a whole lot in place to ensure that we have accident-free Ember months. One, we've improved upon our public enlightenment activities, both at the motor parks, at the marketplaces, the churches, and the schools. I mean, secondary schools, primary schools. We take advocacy campaigns to those places to ensure that we don't just talk to the motoring public, but we ensure that we capture everybody.
It's something you have an idea, but you find out that doctors give you in-depth. You always have something to gain every time you have a retraining. So we are so pleased that the training was arranged, and our kudos to our working state governor, Dr. Mba. He has been wonderful in all aspects, and in this health and rescue is a very wonderful thing. You can imagine when he equipped all the ambulances with all these machines that can help to resuscitate people on coma and accident victims. It's a very wonderful event.